So thank you all for joining us. I'm Amanda Negar. I'm the Certification and Communications Manager at VACC, and I'm joined today with Dr. Hudson Garrett Jr. He served as the first Vice President of the Board of Directors for the Vascular Access Certification Corporation when the organization was originally formed. He then was elected as the President of the Board of Directors for 2 terms and served as the Presidential Advisor. In addition, he is the chairperson for the Judicial Ethics and Disciplinary Committee for VACC. He was the co-developer of the VACC Industry Partner Program and has held VABC certification since the credential was initially launched. He serves as our consulting clinical auditor for VACC and is an adjunct assistant professor of medicine in the Division of Infectious Diseases at the University of Louisville School of Medicine. Thank you so much for joining us here today, Dr. Garrett. We are excited to get started.
Awesome. Well, thank you very much, Amanda, and good afternoon or good morning to each of you, depending upon where you're joining from. We are really excited. This is our second program that we've done sort of similar to this, and we'll continue to do more as the requests come in. And as Amanda mentioned, we are recording today's session, so you'll find that will be available on the VACC website in a week or so that you can go back and reference that and also share it with your colleagues as well. Really, the goal of this session is to answer questions that you have regarding both certification and recertification in case you've got questions regarding that. I know a few people are already certified, so we'll try to make sure we hit on some of that information. We'll talk about what happens after you complete the exam and then also some of the top administrative questions that come up. And so I'm going to sort of cover the clinical and eligibility content, and then Amanda's going to talk about some of the administrative things and resources that are available. I know a couple of you also have questions about resources that are on our website, so if we need to, I'll go ahead and stop our screen here and actually pull up the website if needed. We do ask that if you've got questions that you drop those in the chat. You can send those to Amanda or myself, or you can just put them in the big chat. That's fine too. And Amanda will be sort of looking when I'm talking and vice versa, and we'll try to answer those either as we go or towards the end as well. So I wanted to start with probably the most basic background, which is who in the world is this exam designed for, right? And I want to sort of preface this by saying that the people that are listed here are not the only people that can take the exam, right? And you'll see that it says not limited to on purpose. But the majority of folks that have taken this exam are those that have a very direct role in vascular access. So for example, we've got some physicians, we've got advanced practice folks, we've got respiratory therapists, and certainly probably the majority of our certificants are of a nursing background. We've also got folks that are in complementary fields like infection prevention and control. So we're really trying to make sure that this is an inclusive party versus an exclusive party, if that makes sense. So if you're really meeting the criteria, then we want to have you be a part of this as well. And the other piece to this is that we want individuals that really have that broad representation of understanding on a cognitive sort of knowledge base what vascular access is. One thing to tell you is that this is not a procedural exam, right? A lot of people ask this, and I think poor Amanda probably gets more questions about, well, I insert PICs, or I do this, or I do some type of specific procedure, and that is not relative to this exam, right? This is not a procedural exam. And keep in mind that we don't accredit or certify procedures, right? That is done through the in-house sort of privileges process that's done at your institution. And so that's why we want to make sure that we're very clear about that. You don't have to have specific procedural experience to actually take this exam. Now, there are some general eligibility requirements, right? And we'll sort of go through some examples. And Amanda did a phenomenal job trying to pull together all these different questions that have come through over the last year when she joined the organization. And then we sort of supplemented with that with my, I would call it my old timer experience, being one of the original gang of the VACC board with some of the questions that have come in. So you'll find that there's a minimum requirement from an education standpoint, right? We want a post-secondary education. So for example, if you're an LPN and maybe you got a diploma, if you're an RN and you got an original nursing diploma, if you have an associate's, obviously bachelor's, master's, PhD, all of that's going to be fine, right? What we're looking for is that sort of post-secondary experience. There was something that changed a few years ago. This is not in the original eligibility requirements. When I joined VACC and we actually formed the organization, we didn't originally have a professional experience requirement. That has since changed, and for good reason, right? We want individuals that are not completely fresh out of school, but have some level, a year of experience in that profession, right? And so that is what's originally required for initial certification. Now, if you renew your certification, this is a question that comes up quite frequently. You do not have to still be working in vascular access. So let's say hypothetically that you are the head of a PIC team or vascular access team, and you get promoted and you now become the chief nursing executive. Well, fantastic. Congratulations to you. You can still maintain your certification, even though you're not actively involved in vascular access in your future roles. You may even oversee that team, and you may feel it's very important from a credibility standpoint to maintain that certification. We want to help you do that. So just something to consider. And then you'll notice that there's sort of two buckets. One is what we call the healthcare professional bucket, and the other is what I call the complementary professional bucket. So if you're directly involved in vascular access, let's say you're a bedside nurse, you're a respiratory therapist, maybe you're a physician, maybe you're an emergency medical services professional, just to name a few, and you're doing vascular access on a daily basis, then that's the first bucket, right? You're recognized as a healthcare professional, you're evaluating, you're sort of delivering care there. The second bucket is one that we feel very strongly about, which is individuals that help us support vascular access, like our infection preventionist. I see a few of you on the line today because I recognize your names. Other individuals that are going to be really tangentially related to that, but heavily involved, right? And so there is a pathway for you as well, as long as you meet the other eligibility requirements, which we'll go through on the next slide. So what are those clinical practice requirements, right? And this is a pretty broad stroke. And so it gives people a lot of flexibility, but we do require you to legally attest that you meet these, and this can be audited, and it will be audited in some individuals. And you're also welcome to email Amanda if you're like, I'm not sure, right? And that's really where I try to bring my skill set to say, let's sort of dig through this. I'll have a conversation with you. We can even look through your job description to try to figure out whether or not it's the right fit. As well. In some cases, we'll say, no, it's really not, but here's some other resources. I really try, if I have to tell somebody no, I try to steer them in a direction where there's other resources that will help them get towards their goal. But in the majority of cases, you'll find that there is a good fit here. And so you'll see that you must meet two of these practice requirements. These are also applied to not only clinicians working in a healthcare facility, but also if you're like a self-employed consultant, because we know that there may be individuals, for example, that are clinical educators in vascular access, or maybe they run their own company, whatever it may be, you still have to meet the same criteria. And so the first is really assessing, planning, implementing, and evaluating the care needs of the patients or clients who require vascular access, right? Pretty big bucket. And so that can be the majority of clinically practicing professionals are really going to meet that criteria, because that's probably the bulk of what they're doing. The second area is going to apply for folks that might do, like if you're talking to a patient about taking a PIC home, or they've got now a port or something like that, and you're actually educating those clients or your colleagues, right, and best practices as it relates to vascular access. And so there's a lot of flexibility there. This is not just a bucket for clinical educators. This can be for folks that are really doing this as part of their daily job. The sort of third area we typically find is going to be more in the bucket of folks in a managerial level, where they're actually developing and revising vascular access policies. Certainly at the advanced practice level, that's going to be a piece as well. And then the fourth bucket is going to be management of those activities, right? So that's not just managing a team. That could also be managing sort of the different portfolio of vascular access services that you offer. Maybe you have a bedside insertion team that does ultrasound guided PICs. Maybe you also are a difficult stick team and you go do that. Maybe you do vessel preservation as an example, right? So there's a lot of different areas that might be in that fourth bucket. And then the really last one there is sort of vascular access consultation. So you may be called to assess the needs, the vascular access needs of a patient. You may be developing different policies and procedures in the outpatient setting related to vascular access activities in your health system. So again, there's a lot of flexibility here, but we also want it to be specific enough that you have to meet at least two of these criteria. Now, if you need more than that, great. But if you're unsure, again, we would encourage you to email us at info@vacert.org. And Amanda will drop that email at the end of today's program as well, just so that you've got that. So what is another question that comes up? And that's really about, like, how long do I have to work in vascular access in order to be eligible, right? And we just talked about that. And so I'll just remind again that this is in the candidate handbook, and it's a minimum of 1 year, right? And this is for the initial certification. So let's say you graduate today. You're going to be looking at a 1-year time frame, and then you can sit for the exam in the future. So this is not designed for that new grad. We certainly want new grads to be engaged in vascular access. We want them to start studying for the exam for sure. And we also recognize that there will be professional groups like the CCRN as an example. This is our critical care nursing colleagues that do a ton of vascular access, right? And they've got their CCRN, but we also want them to be involved in vascular access directly. And we encourage folks like that to get their VABC as well. But it's 1 year of professional experience is required for that initial certification. And just as, again, a reminder, if you're renewing, you don't have to maintain that. So you may be changing jobs, and we want you to feel very comfortable renewing your certification. So let's take another question that Amanda came up with. And it's what I'm not on a vascular access team, but I do procedures, right? So maybe I do infusions or I do ultrasound guided IVs, right? And am I eligible for the test, right? So it really just depends. But there is zero requirement that you have to sit on a vascular access team. You don't even have to be in a vascular access department, right? Imagine a critical access hospital that doesn't have such a team. There's no way we would want to exclude those amazing colleagues that are doing that work at their facilities. And so you don't have to be on a team. You do, however, have to meet all of the other eligibility requirements, right? So you got to have your post-secondary education. You've got to have your minimum of 1 year experience. And again, that 2 years of minimal, that clinical practice requirements out of that bucket of 5. So again, it's not based on procedures. It's really based on, do you meet the other eligibility requirements? So what about somebody, again, who worked in vascular access in the past, and maybe they got promoted or they have a bigger role? Are they still able to take the exam, right? So they've got to have that 1 year of experience. That can be at any point, and they still got to meet that attestation. So let's say that this is somebody who is retired, and they do some part-time consulting. I'll just use that as the example. But they don't meet the clinical practice requirements. Maybe they're still licensed. They've obviously got the 1 year of experience, but they don't meet the criteria for clinical practice. Then that would make them ineligible to take the exam. If they did, however, still meet those clinical practice requirements, then they would be eligible. So again, it's not saying that 1 year of experience has to be right now, and it doesn't mean that you still have to work directly in vascular access, but you have to be able to demonstrate that you meet those eligibility requirements as well. So here's another common one that comes up, and it seems, and Amanda, correct me if I'm wrong, this seems to come up quite frequently lately, where there's a little bit more of a procedural sort of ask, and we've gotten several questions about phlebotomy, and not in any way to diminish the role of phlebotomists, because they play a huge role in the collection of our laboratory specimens and certainly things like blood culture collection and stuff like that. So they do an amazing job. But remember, this is a vascular access test. And so we're looking for healthcare professionals, right? And really, this is going to be primarily licensed healthcare professionals that are going to have a broad representation of vascular access experience. So the role of a phlebotomist is going to be so narrow and limited that it's not going to meet the minimum eligibility requirements to do that. In addition, you'll find that a lot of phlebotomy programs do not meet the post-secondary education requirements as well. And so it depends on sort of what the program is, but it's pretty impossible for you to meet the 2 of the 5 clinical practice requirements for phlebotomy specifically. And again, we just use this as an example because this has come up quite frequently. Now, this is an example where I remember one individual reached out to me about this, and they did not actually know that there was a national certification for phlebotomy. And so I redirected her towards that, and she was all excited and has since passed that exam and is now certified in that field, which is fantastic. So we recognize that there may be individuals that may be sort of loosely involved in vascular access procedures, but they've got to meet, again, the criteria for the cognitive knowledge is really what we're looking for versus the procedural piece. So what about our colleagues in emergency medical services, right? I can't think of somebody who probably does more vascular access on a regular basis. Most patients that are transported to the emergency department are going to get some type of vascular access. Not only may they get the insertion of things like a peripheral line, but you've got intraosseous, which is becoming more and more used in the pre-hospital setting. You've got folks that are actually accessing ports and other types of lines, PICC lines in the field as well. And then you're also seeing a tremendous amount of community paramedicine programs where these are paramedics and EMS professionals that are going into the home and are actually delivering pretty extensive vascular access care as part of that community care model. And so great for our healthcare system to have these professionals. The nice thing with EMS is that they're going to either earn a certificate or a diploma, so that is going to meet the criteria. And then we're seeing more and more of these programs are actually going to an associate's, and some programs actually offer a bachelor's degree as well. So that's going to take care of the the post-secondary requirement. They do need that 1 year of experience. And so this can't be somebody who just graduated, EMS school, yesterday, and is going to try to take the exam. They do have to meet that 1 year of experience. And then of course, they've got to have their sort of 2 out of 5 bucket areas. And again, with EMS, that's very easy to meet, especially for folks that are in the field to do that. So we certainly welcome and recognize our EMS professionals for that. Here's another one that comes up, and it's ultrasonography. So, and we actually, I think Amanda just got this one about a week ago. So this one comes up quite frequently. And I hate to give a legal answer, but my brother is an attorney, and so he's always taught me to say it depends, right? So, but it's unlikely is sort of my response here. And the reason being is that the limited scope of practice, right, and sort of the specific procedural piece that person is trained on is likely not going to meet those requirements. And so again, we're not looking for specific procedures, but they've got to have that broad representation of the vascular access knowledge base, and specifically the 2 out of 5 clinical practice requirements. So just doing an ultrasound is only going to meet sort of 1. And just doing an ultrasound by itself is not going to meet that. Now, if you're doing that, for example, in like a cath lab or something like that, there's a little bit, I think, more relevance there, but they've still got to meet the 2 out of the 5. And so generally speaking, these are not professionals that would meet that criteria. And again, there are national certifications that we can recommend for that as well. And so I try to always point them in that direction. So what about industry as an example, right? And so if you are working in industry as a clinician, and I see several people with industry email addresses, industry is a huge partner. They are folks that deliver the clinical innovation and the products that we need in order to provide clinical care for our patients. And so we need to recognize that. And so there is a pathway if you are working in industry and you are a clinician to be eligible for the exam, but it depends on sort of your role. And so I know Amanda and I've dealt with this many times with folks that have literally sent in their job descriptions, and some meet the criteria and some do not. For example, if you are a clinical sales specialist, it is unlikely that you will meet the criteria, even if you are a clinician by background. But if you're like a medical science liaison or clinical specialist, and you do 2 of those 5 criteria and you meet all of the other eligibility requirements, then just because you work for industry, you can still be certified, right? It doesn't matter who your employer is. It matters what you actually do and what your eligibility requirements are, and if you're able to meet those. So for example, if you happen to be a nurse, as just an example, and you have a bachelor's degree and you have 15 years of experience and you meet 3 of the 5 criteria, then you are eligible to sit for the exam. And so again, that really just depends on what that is. And again, if you've ever got questions, feel free to email us and we can always answer those on a one-off basis. So let's take the flip side of that. Let's say that you've got somebody in industry that is a sales professional, right? I think we all have our favorite sales reps, for different things. And, these are folks that make the world go round. They bring the products to us that we need in order to deliver care and also bring innovation. And so sales representatives are not going to be eligible for the exam. However, right, back in the day, I hate to age myself, but we thought about this at the sort of original outset of VACC, and there were some points of confusion. We said we need to develop something for industry specifically. And so we do have our Vascular Access Industry Partner Program, which I've included the web link there. So when Amanda sends out the slides, you'll get that live web link and it'll take you directly to the VACC website. And there is a 10-module program that you can actually utilize in order to become more educated as a vascular access partner. And if you are off mute, if we would just ask that you put yourself on mute, that would be greatly appreciated. This is a program that does require renewal. And again, it's really designed specifically for sales and marketing personnel so that you can do that. What about if you're an LPN, right? This question comes up. And again, we have specifically included LPNs in the eligibility documentation. So as long as you've got that post-secondary education, which certainly an LPN would be one, then you are eligible to take the exam. You've still got to meet that 1-year professional experience and then also meet the minimum of the 2 out of the 5 clinical practice requirements as well. So, but LPNs are absolutely, and the same is going to be true for diploma nurses as well. So there's really no difference from that perspective. And that's really what this next one is. And you'll see again that the nursing diploma is called out. Some of the most amazing nurses I know are diploma nurses. Just talk about a great skill set and really just a wealth of clinical information as well. They simply don't make those programs anymore, unfortunately. So, we want to make sure that individuals that have that background are also included certainly as well. So what about somebody who is a graduate from a radiography program? And again, it's going to go back to that answer of it depends, right? So it is unlikely that you're going to find individuals in this role that are going to meet the clinical practice requirements. And they're probably not going to have the actual broad representation of the cognitive knowledge that we're looking for as well. So again, we're really looking for people that have a very specific, broad array of experience and understanding of vascular access. And this is a little bit different than some other exams out there. We're not looking for specific procedures, like this is not a PIC test, this is not a peripheral test, it's not a midline test, it is really about vascular access knowledge, so that the clinicians that hold this certification are really up to date on the most sort of relevant issues affecting vascular access as a specialty, for sure. So what about the differences between like our exam and, for example, the CRNI? Right? There's really a place for both. They're very, very different exams. The CRNI, of course, is open to registered nurses. It's really focused more on infusion nursing. And you're going to have certainly individuals that really like that. I know many individuals that are, duly certified, and great for them. And you're going to look at CE content for both of us that are going to be specific to those content areas on their exam. So the VACC is multidisciplinary. So you could be a physician, you could be a nurse, you could be a respiratory therapist, an infection preventionist. It really is open to many different professions. And you'll find that the content outline is very broad, right? And that was really by design, because we wanted something that was representative of all different aspects of vascular access, not just a particular area. I know one colleague, for example, that is certified with VABC. She has her CRNI, and she's also got her ONS certification as an oncology nurse as well. And so she does actually 3 different roles within her hospital, and more power to her. So a lot of stuff to maintain for sure. You'll also find that the CE opportunities are pretty boundless. Whether you're a member of AVA or INS, doesn't matter. There's lots of opportunities there. And then there's a ton of online and other conference resources that you can do locally, as well. And so those resources are available on the VAC website in case you're interested as well. And we've also got a portal once you're certified that allows you to track this information as well. So with that, I'm going to turn it over for a few slides here to Miss Amanda, who's going to talk about some of the dates and fees, and then also where to access some of this information. And then we'll cover a few more pieces of information, then see what questions we have, because I see a couple questions in the chat. So Amanda, I'll go ahead and turn it over to you.
Sounds wonderful. Thanks so much, Hudson. That was very informational. Absolutely love how much depth we're given into that. So I'm going to move on to sort of the general questions. Aside from eligibility about the exam, we have 2 testing windows, so one in June and one in December. And we open up applications for those about 3 months ahead of the testing window. So you can test anytime in June, anytime in December, whenever works for your schedule, as well as the testing center nearest you. And then for applications, we open them up March 1st for June or September 1st for December. And we have an earlier application window, as well as a final registration window. And that will continue through April 15th or October 15th, depending on your testing window. And of course, we also have a few discounts for if you retest, as well as if you're a member of the Association for Vascular Access. But we mostly do our application process online. It's easiest for you guys, as well as it's kind of gets you in that cycle of doing things online, as well as that's how most people schedule your exam too. So it kind of gets you in that mode of going online for most of your application and scheduling. If you need special accommodations for your testing, contact our offices as soon as possible so that we can send you the ADA required form that you'll need to fill out, as well as have a physician sign on to, or professional documentation of some sort. And then you can return that to us so we can make sure you get the accommodations that you need to successfully test. One example of this is, let's say you just had a pretty big back surgery and you're not able to sit for the full 2.5 hours of the exam. What you can do is fill out that ADA request form, and we can make sure that you're given extra time, for example, for you to get up and walk around, take a break, so that you don't have to sit for that full 2.5 hours. That's just one example. We see a few others, but again, contact us so that we're able to get you those needed accommodations to make sure that you can schedule your test at the right time, and the testing center knows well ahead of time that you're going to need these extra steps.
And I'll just say I've been a victim of this, if you will. When I broke my foot years ago, I needed a sort of an accommodation, and to be honest with you, I was embarrassed to ask. And I remember calling the organization, and the woman started laughing. She said, "You're the third person this week to break their foot." She said, "What is going on with you guys?" And she was so generous. And not only did she make the arrangements and everything, but I'll tell you that the Prometric staff at the testing centers are very accustomed to dealing with this. So when I got there, I can't speak for every testing center, but the lady actually had a pillow that she had brought from some other office and put it in a chair so that I could elevate my leg during my exam. And I still remember that to this day. So I think, to Amanda's point, don't ever be embarrassed or ashamed to ask for these accommodations. They absolutely, first of all, you deserve them. And we want you to be successful. And so if you have something going on, whether it's sort of intermittent or long-term, let us know so that we can work with you. And also work, if we need to, with your provider to see what the right accommodation is for you. And then that way they can make those take care of those for you. I think it's just a really important thing to stress.
Absolutely. Great point. Okay, so we have this question a few times every testing window, that you can't make it to your testing appointment anymore, depending on your situation, whether it's just that you got scheduled for work and can't redo it or anything like that. The main thing is to contact our offices at VACC as soon as possible so that we can get you the right instructions for canceling your exam. It's a bit of a lengthy process, really doesn't take more than, I would say, 10 minutes max, but you must first cancel your exam at prometric.com/VACC, and that is our testing provider, Prometric. So you have to cancel it through them first, at least 5 days before your exam date. And once it's canceled with them, then you can go ahead and ask for a refund through us or a transfer to the next testing window. Those are sort of your two options. You can also schedule in the same testing window if you'd like to. If, let's say, your test is scheduled for earlier in the month, you got scheduled to work and you can't redo it, what you can do is go ahead and reschedule for later on that month, but it has to be at least 5 days before your scheduled appointment date. And like I said, ask us if you have any questions, because ultimately we want to make sure that you are going through this process the right way and you don't have to forfeit the fees at all. We want to make sure that you're getting that refund or transferring to the next testing window, whatever is going to work with your schedule. And of course, if it's underneath that 5-day period, what you can do is still come to us. If it's an emergency, we're always happy to review those and approve them on a case-by-case basis, because ultimately, like I said, we want to help get you tested. We want to make sure that you are getting this credential if you can, and we want to make sure that you are being as safe as you can be, depending on the situation, or as comfortable as your situation allows.
Yeah, I know we've had a few people that have, for example, had one of the just horrific experiences of losing a loved one. And especially during COVID, there were many accommodations made. I'll just say that. So I think the key in what Amanda says is please be as proactive as possible, right? We're all adults and we can't be mind readers, but I will personally vouch for, because I've been involved in it, VACC will go above and beyond the call of duty if we can. And so if there's something we can do in your favor, if we have the ability to do it, we will do it, especially for the right circumstances. So if you, have a loss or you become, very, very ill, I know we've had candidates that have gotten COVID. We don't want, first of all, you can't be in the testing center, but we also don't want you in the testing center when you're not in the right mental mindset. And so we want you to be successful and as comfortable with this. So just try to, keep that in the back of your head and reach out when there's specific questions. So the next question I'm going to actually tackle, because this is one that comes up all the time. And I see this also in the chat as well. So I'm going to try to address a couple of the questions that came up in the chat as well. So the really big question here is like, what study materials or is there a review course that VACC offers? And the answer is because we're an accredited exam, right? So we're an independently accredited exam. Our sole focus has to be on the development, maintenance, and execution of the exam, right? It would really be a conflict for us to develop a review class. Now, let me tell you why, and I'll just use myself as an example. So I was involved in the original development of the VACC board and the corporation, have seen every single question on the exam. it would be absolutely wrong, unethical, and frankly, a violation of my contract as a former board member for me to go out and develop a review course. Because as you can imagine, if I did so, everybody would probably pass because I have the insider knowledge related to that. And so the same is true for VAC as a corporation. So because they are the authors and the maintainers of the exam content, they're not involved in exam review. And that is really a very strict accreditation thing to make sure that there's zero conflict of interest related to that. Now, what they do though, and this is something that I can pull up if needed on the website, but if you go to the candidate handbook, you'll find several resources that I think are particularly helpful. And this is sort of my strategy. You can use it if you like it. If you don't, that's fine as well. Everybody has a different one. But I started with the content outline and I got out 3 highlighters. I got a green highlighter out, a yellow highlighter out, and sort of a pink one. My green was things that I had very, very high confidence that I knew that material, right? So if it was something that I was super confident with, I put green through it. The stuff that was yellow was, let's just call it areas of I felt like I had a pretty good knowledge base, but I wasn't 100% sure. And then my sort of pink or red, if you will, were areas that I don't practice all the time. For example, I don't do a ton with neonates. I can in an emergency, but really that's going to be like IO access and stuff like that. So I don't do a ton with neonates. So that was a red area for me. And so you can start there and look at the content outline. Keep in mind that the content outline is essentially the blueprint for the exam, right? So it tells you not only the topical areas, but what percentage of questions are going to come from there. So if you're really, really weak in like quality and patient safety and evidence-based practice, then you might want to beef up that, but realize that that's a smaller bulk area of the exam. And so you can sort of use that. There's also a certificate readiness tool that's available on the website as well. That's going to sort of help you identify that. You're going to see the exam references, which that is literally every single exam reference that we use to develop the exam and currently today. And then there's also some practice questions that you can purchase as well. So just to sort of address the elephant in the room and some of the questions that came in, we are absolutely aware that AVA has a study guide, and I've also seen other study guides as well. None of those are reviewed or endorsed by VAC board members or any member of VAC. I have the AVA study guide as an example. I've certainly seen it, and I can't give you any comment on it. And so that is by design because we don't want to be involved in biasing the exam pass rates. And so if you see other, courses, review materials, or anything like that, just know that we've never officially reviewed them. We won't be reviewing them, and we don't endorse them. It's not to say that they're not high quality. It's simply saying that we don't actually get involved in that process. So our role is to develop and administer the exam. Other, either independent organizations or, professional membership groups may develop their own content, and that is fine. But don't go into that thinking that if you take that course, you're going to pass our exam, because that may not be the case for sure. And so I think, again, the best thing to do is to take control of your own destiny. Look at the content outline. I would absolutely suggest doing the practice review questions. Those are very helpful. It gets your mind in sort of the mindset of what are the types of questions on the exam and how would they feel when I read them as well. And keep in mind, this is a computerized exam as well. So you want to be familiar with that. When you go to the testing center, for example, there's going to be a tutorial. If you have never taken a computerized, sort of based exam, do the tutorial. Do not hit skip. Make sure you go through that process with Prometric. Ask the testing administrators if you've got any questions as well. So I just wanted to make sure to address that. So I saw a couple of questions about the review manuals. So that would be our response is you are welcome to use any and all review sources that you find, but just keep in mind that VAC is not involved in those. And that's by design. But if you can go through that content outline and you take the exam practice questions and you feel very, very good about that, it's pretty rare that people will really struggle with the exam in my experience. The folks that do that really have a very methodical way of studying. And of course, that's going to be individualized based on how you like to study. Some people study in groups. I'm not one of those people. I just get very distracted with that. And so if you've got other specific questions, you can look at our website and it does give you some information specifically on that. The candidate handbook is available there as well. And I would print those couple of pages and we can go through that if we need to at the end of here as well. So any questions on the study materials? I think I covered, from what I saw, most folks' questions as well. And I see one person sent, she actually passed before there was a study guide. So congratulations on that. for sure. So I don't think I see any other questions on that. So Amanda, I'll turn this back over to you. And then for those of you that got other questions in the chat, I'm going to do those at the end, but I just wanted to cover that one here. So Amanda, I'll let you talk about scheduling the test.
Perfect. So one question that we get pretty often is how you go about scheduling your test. We do scheduling online, though you can do it over the phone with our testing partner, Prometric. They're the ones that administer the test at their locations. So once you submit your application, if it's approved, you'll be emailed an authorization to test letter. And what this is just a quick email that says your name, as well as a little code that you'll use to schedule your exam, as well as instructions on how to schedule that exam. So you can schedule it, like I said, anytime throughout our testing month. So either anytime throughout June or throughout December, depending when you are applying to it. And it will just kind of depend on Prometric's availability as well, but you should get that authorization to test letter in your inbox within 3 to 5 business days of receiving your application. Usually it might actually be the next day, but if you don't see it after that 5 business days, give us a call, send us an email, because we want you to be able to schedule your exam as soon as possible, because scheduling can fill up the longer that you wait to schedule your exam. It might be not working on a day that's right for you. You might have to end up not taking the exam, that testing window, and transfer to the next one, or whenever would work better for you. So ultimately, contact us as soon as you can if you don't see that email to your inbox, because we want to make sure you're getting scheduled on a date that works for you and everything goes smoothly.
And Amanda, there was a question buried up in the chat about, are we still offering the remote option to do remote proctoring, or is it only in the testing center? Can you go and address that for this one?
Great question. Yes. So we are still doing remote proctoring as COVID is still, unfortunately, a factor of our lives. So we are offering that option for people who aren't quite comfortable to test in person. I will say that in 2021 and 2020, there were some hiccups every now and then. We always gave people the chance to reschedule in person, or possibly even later in the month via remote proctoring. And it's also really helpful for people that have worked, third shift. We had a few people in our December testing window who were testing remotely because they really didn't want to change up their sleep schedule and have to go take an exam at 8 a.m. or in the middle of the day, what have you. So that is still going to be an option for 2022. As far as I know, for this June window, I can't speak for December yet, though I imagine we'll take it on sort of a case-by-case basis for how that goes. But yes, we will still have remote proctoring as well as in-person, but we recommend in-person if at all possible for you, just because if anything happens, then you have hands-on staff that are ready to help you through any technical difficulties you might have.
And keep in mind, if you do the remote option, Prometric does give you an option to do a test run, if you will. And they send that when they register your exam appointment. I just went through this with them, and make sure you do that. And I'll just use myself. I use a Mac. And so I went through that, even though I've done their tests multiple times. I've got several certifications that I've done through them. And there was one issue with my browser that had updated, and it actually flagged with that. And so I then repeated the process with Chrome instead of Safari, and I was able to get it to work fine. And when I actually got my proctor on the line, she was very helpful. She said, "I'm glad you did that, because now everything should work." And it did. So take advantage of that process in case you are doing remote. We certainly want to be respectful of folks that either don't feel comfortable, or maybe they can't find an appointment that's around their schedule. And so the remote proctoring can be a great option for those of you that are looking for more flexibility. Like I took an exam recently at 10 o'clock at night. And that was fantastic for me because there was nobody else around. The other thing I'll mention too is really carefully follow their guidelines. So don't have any animals in the room, don't have any people in the room. If your dog starts walking through and they see shadows, they will shut your test down. So it is very closely regulated, because this is a high stakes exam. So I think, to Amanda's point, if you go to the testing center, you do have a lot of flexibility. If there's anything that goes wrong, there's literally somebody sitting around that can troubleshoot as well.
Perfect. And I see we have a question in the chat about authorization to test letters. So I just want to get that out of the way while we're on the topic. They asked how much time is allotted between the authorization to test letter and the date of the exam. And that really depends on when you're putting in your application. So like I said, we are able to schedule as far as if you sign up even let's say May 31st, which we don't recommend because scheduling would be tight at that point, but you are still able to schedule your test at that point. So it really does depend on when you're submitting that application. Let's say you submit it March 1st when it opens up for this June window and you get your ATT letter, let's say March 2nd, or even as late as March 5th. So you're able to schedule that same day that you get that authorization to test letter, and you are able to schedule as far out as you need to through June 1st, though I do not recommend it. I recommend scheduling as soon as you can. So this next question, if your name and address on your authorization to test letter doesn't match the name on your government ID, we will need to be notified of that if that happens. Your middle name doesn't necessarily have to be on your authorization to test letter if it appears on your government ID. We're not so much worried about that, but Prometric is worried about first and last name exactly matching in their system as on your government issued ID. And that includes if you have a hyphenated last name or something to that effect, or let's say you go by a nickname, but your government ID has a totally different name listed as your first name. So we will need to be notified of that before you schedule your test so that the testing center knows and you're not being flagged at all. The addresses don't need to match, though we do need your correct address on file just for our purposes and our system. So if that doesn't match at all, feel free to let us know. But just make sure that first and last name appears exactly as it does on your government ID.
And one comment just for those that are licensed, you know, this obviously goes without saying, but make sure that whatever you put with VAC matches your professional licensure, so that it, you know, there are several states that allow you, if you're board certified, they allow you to waive, for example, your nursing CE. So we want to make sure there's no issue where you're having to call them in and say, oh my gosh, my certification doesn't match. So go ahead and make sure that it matches so that everything, your licensure, everything is the same. And that way you won't have any issues with your state boards as well.
So once you test successfully, you'll get an email with your official results. We call this your score report. You'll get that email within 24 hours emailed to you by Prometric. And that should be pretty easy, but if you, for some reason you don't see it, feel free to let us know so that we're able to get you that as soon as possible, because most employers do accept this in terms of, let's say getting certified is necessary for your job. They will accept that score report. Otherwise, they will accept it for reimbursement or for a raise, what have you. So I know I passed, but how do I see my score and what questions I got right? So for test confidentiality, test takers can't see exactly how they scored on specific questions. So you aren't able to see, oh, on question 12, I answered with this, but it's supposed to be this answer. We don't do anything like that for test confidentiality reasons, but we do give scores and indications for improvement in content areas generally for those who fail, to guide them if they choose to retest. So really what that is saying, you know, you're proficient in this general area, and you can find these areas in the content outline like we talked about, or it'll tell you this area needs a little bit more work. So that's really more meant to be a guide for the next time you choose to retest, if you do choose to retest. But those who pass specifically aren't given scores or those indications. Okay, so this is another big question that we usually get for people who pass. They're ready to go. They want that certificate, that digital badge that says they passed and they are now certified. So we don't send out those digital badges until the closing of the testing window when we get those final results from Prometric. So it's usually a few days into the next month. So January or early July, depending on when you test. But we get those out to you as soon as possible. Certificates are included in those digital badges. We don't send them out over the mail. That's another question we sort of get frequently. But if your employer needs something sooner for any reason, feel free to ask us and we'll be able to provide you with something.
And just, I don't know what the current rate is, and Amanda, you can jump in here, but I know in years past when we launched digital certificates and sort of the digital badging, it was a pretty low adoption rate initially. And as we see more and more certifications go here, and that's primarily their means of communicating that you pass or not, really strongly advise you to take advantage of this free resource. We're excited to be able to offer it to you. And so it's also a great way for you to showcase your certification. So you can put on your LinkedIn, and there's all kinds of ways to use it, your email signature. And it really allows people to get an idea of, wow, there's a lot of folks in my organization that have this credential. And I think if I look at others that do this really well, the CONR, the OR nursing group does this really well, and a couple of other groups. So just keep that in mind and take advantage of this. These are all resources to help you market yourself to your employer, to your patients as well, and to other colleagues as you go out and present. So there were a lot of questions in the chat. I'm going to try to go through these and see to make sure we do this. If you do have other questions, feel free to shoot those in the chat box, and Amanda and I will look over those. So I'm just going to sort of go in the order that was received. So Julie had a really good question, and she said she had tested a few years ago and was not successful and was looking for the best ways to study and prepare. So 100%, you need to go look at the content outline. If you've not downloaded that candidate handbook, I'll tell you what I'm going to do. I'm going to stop the share for just a second. I'm going to pull it up because I see a couple of you have this question. So it might make sense just to actually do that. So give me just 1 second here. And I'm going to share the candidate handbook so we can sort of go through this. And again, this is going to be available on the VACC website. And so I'm just going to scroll down to where that is in the actual book here. So this is going to give your overall domains. And so if you look at the domains here, you're going to see clinical knowledge and application. That's going to be 65% of the exam. So you're looking at a total of 81 questions. So if you don't know this area, you're not going to pass the exam. Sort of right behind that is going to be interprofessional and communication, because we know that vascular access is a field that is really going to interact with many other disciplines. So you're going to see a total of 18 questions, or 15%. And then your professional development and legal and ethical considerations are both an equal 10 or 13 questions. So let's just say hypothetically, you do really, really well in the first and the second domain, you do moderately well in the third domain, and you're average in the last domain. You're going to be able to pass, right? Because we're looking for, does that person have the minimum cognitive knowledge in order to meet the requirements based on the sort of job description that we've looked at in the job analysis. So there's a job analysis that's updated every 5-ish years that looks at vascular access professionals from all different disciplines, right? And that is what is used to determine what the questions are on the exam based on that information. If you go behind that, though, this is where you get the real meat. Right. And so you'll see that this was updated in 2020, so only a year ago. And this is typically, like I said, updated every 4 to 5-ish years. You'll see the content category here, and then below that are sort of the subcategories. So if we look at device assessment selection, we're looking at CVCs, we're looking at peripherals, dialysis, apheresis, all that kind of stuff. Patient assessment, you'll see vascular pathology, device selection. And we try to give as much information in there. Keep in mind that you're not going to be asked about the specific procedure per se. You're going to be asked about, for example, maybe the intent, or what's the benefit of that, those types of questions. So again, it's not a procedural exam. And if you keep going, you'll see that that's broken down by every single content area. And so again, if you're really weak in a specific area, maybe you don't do a lot of troubleshooting as an example, or you're not as knowledgeable as you'd like to be on complications, then you need to go down here to F, and you really need to study up on that. So just as an idea. And then the last two domains, I see a lot of people struggle with these because they don't think about this stuff. So for example, what are the best patient communication strategies? How do I communicate with a peer? Maybe this is not the right thing, the right device for this patient. How do I have that conversation? What do I do if I've got somebody from a different religion, as an example, and there's a cultural barrier there that I need to address? So those are some examples of content that would come from that sort of category A piece there that's under that second domain, right? And so again, this is where I would literally sit down with a highlighter and start here. This gives you a really good idea from that information. And if you go down, you're going to actually see the exam references. The ones that are available as a hyperlink, we've included those for you as a courtesy. Many of them are also free. And as the exam itself is updated, you'll see that this information is updated. It does take a while to update exams. So for example, let's say CDC came out with a brand new guideline next week. You're not going to be tested on that on this exam because it's not yet made it into the exam process. And keep in mind, for your protection, exam questions just don't show up on the exam. They are beta tested first. And so you will see on pretty much every exam that you take professionally, especially in the medical field, you'll find anywhere from 10 to sometimes 25 questions on exams that are not counted for or against you. We are literally just testing the validity of those specific questions and gathering statistics. And let's say that 75% of you fail that particular question or miss that question. That probably means that either the question itself is poorly developed or the answer is not right. And so it's very unlikely that the answer is incorrect. It's almost always that the question was poorly developed. So there is a lot of protection that goes into developing these questions. Not only are they reviewed by subject matter experts and developed by them, but they're also reviewed by our experts at Prometrics, which, these are folks with PhDs and psychometricians, and this is what they do for a living. So there's a lot of protection that goes around that as well. So hopefully that answers some questions regarding preparation for the exam as well. So let me keep looking here. I saw a couple of people said they were mentoring folks, and is there any restriction in doing that? Absolutely not. So the only restriction we have is for either currently sitting members of the VAC board, certainly the staff like Amanda and Brian, who is our executive director that's not able to join us today, myself, and then members of the board that are off the board for a period of 2 years. So they can't be involved in the development of any resources. And that, again, is for the protection of the exam. That's something that we're extremely stringent about, because it could compromise the exam. An average exam could cost anywhere from $250,000 to $500,000 to develop when it's all said and done. When you look at all of the sort of time, energy, money, all the fees to the testing body that go into that as well. So they're very strict about that. But you as a individual certified professional can certainly help a friend out and help them study for that. That's not a problem whatsoever. Looks like the next question, and I think I addressed this about the review manual, but I still have the first edition review manual. Is this still the most appropriate study resource? So I'm assuming you're referring to the AVA study guide that was developed. And again, we don't have any input on that, nor any opinion on it. So if that is a resource that you choose to use, you're certainly welcome to do that. Again, I can absolutely tell you from experience that if you look through the content outline and you use that in the exam references, you will be much better prepared, because it gives you an idea of where that information is coming from. And then really definitely strongly encourage doing the practice questions, because they get your mind in the right mindset. I think that's always helpful. It's certainly not going to give you, the questions, but keep in mind that the practice test questions are questions that did come from the exam. So they are retired questions that have come off the exam. So they're in the exact format that you will see. They're just going to obviously be different things as well. A couple people had asked about access to the recording. Absolutely. So we are recording today's session. Not only will you get the recording, but the actual slides will be available on the VAC website as well. I think Amanda said she needs about a week to post those. So we understand that some of you are driving as well. So those will be available. So here's another question, and I'm going to try to tackle the first piece and then ask Amanda if there's any developments on the second one. And the question is, why is the exam only offered twice a year? So historically speaking, the reason that was done was because the numbers of individuals that were eligible and wanted to take the exam were not as sort of large as some of the very large certifications out there. So if you look at like critical care or the OR, where they've got over 100,000 certified people, we're not at that point. And so from a financial standpoint, the decision was made to offer the exam twice a year. Now we have offered it more than that in years past. For example, we've offered it for international colleagues with certain things. We've offered it in the past at the AVA conference during that month. So there have been some exceptions to that rule, but historically it's been sort of a way to contain cost. It is very expensive to do certification exams. We wish we could make the exam fee, much more economical, but unfortunately we can't. It is extremely costly to use testing centers, and it is extremely costly to develop legally defensible exams as well. So Amanda, I don't know if there's any developments on that as far as potentially offering it more than twice a year. So I'll just sort of let you chime in on that if there are.
I think you covered it really well, Hudson. Mostly it is good for us to know if that's something of interest, and we have enough people, as Hudson said, to kind of get us through several testing windows and not just two. So it's always good to hear that feedback from you guys, because it allows us to take a look back at our numbers, what we're doing currently, and also the requests from everyone who wants to take the exam. It definitely helps us in gauging if twice a year is still something we want to do, or if we have the means to do that on a more rotating basis.
Awesome. Let's see here. I think the next question was, is there a disclosed pass rate for the exam? And I'll sort of start generally there first. So Amanda, do you want to talk about that?
Sure thing. Okay, so I'm going to address, this person also said they know someone who did not pass, or who didn't pass the exam by 1 point, and can that be challenged? So as we said,
that's a different question. I want to get to that one in just a minute. So
sure.
I know we used to, and forgive me for not knowing, do we still publish the pass rate on the website?
We do, yes. So our average pass rate for 2021 was 88%. So that's all available for you on the site. The score necessary to pass the exam, it is not, I will say it's not directly correlating to how many questions you get right. So we do this on a bit of a sliding scaled, so they call it scaled scores. So that kind of, it doesn't necessarily translate to, oh, okay, out of the 150 questions, I got, let's say you got 100 right. Your exam score would not necessarily reflect that amount, that specific amount. So if you'd like, I can kind of ease into that next question then of knowing someone who didn't pass the exam by 1 point. So with that, when, if for some reason you do fail your exam, you're going to see that scaled score. And like I said, that doesn't necessarily reflect how many exact questions you got right or wrong. That scaled score is something different from that. So that 1 point doesn't mean they just missed one question. That meant that they were below that minimum competency that Hudson talked about before. So it definitely can be challenged if you, for some reason, you had some technical difficulties and you believe that that led you to score lower on the exam when normally you would have scored higher. It can be challenged for those sort of instances, but I will say it is a bit tricky just because it is about that minimum competency. So most of the challenges we do see do have some sort of technical aspect, but it does have to be on Prometric's end. They also have to report that technical difficulty.
Yeah, I'll just say, and I think I've been involved for seems like 13 years at this point. I can't remember. I'm aging myself. I have never once seen, the disciplinary and judicial committee overturn that. So I think to Amanda's point, she's probably being a little bit generous. If you have a testing irregularity, I cannot stress, and I think she just said this, I cannot stress enough to immediately report that to Prometric. If you're at the testing center, you need to get, raise your hand, do whatever they tell you to do, report that immediately. So if their system kicks you out of the exam, as an example, that's fixable. If you have a remote testing issue and let's say, I don't know, you lose power, that's fixable. What we are not talking about is that you actually do not pass that section. So if you do not pass that section and you see that scaled score, and let's say it says you need a 70%, you get a 69%, that itself is not challengeable. So I just want to be crystal clear on that because we get a ton of questions about this. And I always have to be the bearer of bad news that that's not challengeable. That is a cut score that is set with meticulous thought. And it is a legal thing to protect the exam's integrity and also make the exam legally defensible. So that's not something that VACC sets. It's something that's done with our subject matter expert team and our Prometric partners that do this for a living for thousands of certifications across the globe. And so if you see that, that unfortunately means that you didn't meet the minimum criteria. And I think that's the key to, when I tell someone who's certified, you met the minimum criteria, they find that offensive, right? Because they think, no, I'm not minimum. It doesn't mean it that way. It means that based on a national job analysis that you met the identified minimal criteria in order to pass, right? So that if we were to hire you, let's say Amanda works in Ohio and I work in Georgia, if I see a candidate with that exam and they pass that exam and that certification, then we both have an idea of what that means, right? So it sort of levels the playing field from a professional standpoint. It can't guarantee future competency, obviously, but at the time that they took the exam, they were able to pass. So that's really what it means. Being certified does not make you an expert. I always hate to tell people that, but certification is really a gateway towards additional professional development and advancement, and it's a starting point. It's a very exciting starting point, and I wish everybody was certified. But I also don't look down or sort of, think less of someone who is not certified. There are individuals, I have testing anxiety myself, and so we want to be sensitive to that. But if you don't pass by, quote unquote, 1 point, that doesn't mean that it's just one question. It actually is more than that. So hopefully that sort of clears that up as well. It looks like there was a question about, are there any details about taking the exam internationally? This individual is in London. So Amanda, I'll let you sort of tackle that one.
Great question. So we have had people that have taken it abroad in the past. So I believe in December, we did have someone take it from the UK, at least one person. Prometric, last I checked, does have testing locations depending on your country. So if they, for some reason, don't, that's where that remote testing option comes into play. But I will say, if you come to us and you're asking, oh, I want to see testing locations in Georgia, for example, we don't have access to that. So that's more of a Prometric side of the deal. We, on our end, do not carry a full list of all the operating Prometric testing agencies everywhere. So I will say that's something that you would have to look up with Prometric. That's not something that we have access to, but remote testing, great option for if you don't have one near you. But they do have, Prometric does have testing locations, last I checked, in the UK.
Yeah, and one of the reasons we initially, there's about 4 or 5 big boys out there in the testing business, and Prometric is the largest. So they have got, we've had people take it many different places across the world. I do want to, however, caution, and this is not really explicitly in the candidate handbook, but it is on the page that I'm looking at now, is that if you are from abroad, fantastic, we welcome you, but do keep in mind that all of the exam content is based on US standards. And so there may be some discrepancies or differences. Like I know, for example, the UK uses the NICE guidelines and some of the other things. Just keep in mind that as you study, while certainly some of the generalized content may be similar or the same, there may be some individual guidelines that are quoted, like, for example, the CDC guidelines, just as one here, that's going to be US specific. So you would need to study those in order to be successful with those particular questions on the exam. So we don't, unfortunately, offer a version for each country. That would be extremely cost prohibitive, and we want to sort of maintain the exam. But we've absolutely had people from Europe and other places take the exam and be successful. So just wanted to mention that as well. And it looked like there was one other question about if I have future questions about my readiness, who should I best contact? So you can certainly email Amanda at info@vacert.org. Just keep in mind that it's really going to be limited to what I just told you, is what we can give out. We're actually going to be, right after we finish today's program, we're going to be sort of recording a little subset to talk about that question specifically about exam preparation and sort of the resources in the candidate handbook. That should be available in the next week or so as well. So you can certainly check that out on the VACC website. And if there's specific things that are not clear, feel free to email the team and let them know. That's really the reason that we've done now. This is our second program, and hopefully this has been really helpful for you. Our goal is to make sure this is a friendly process, one that helps you grow as a professional, not one that is a hindrance. That being said, there are also certain rules and regulations we have to abide by as professionals, as in an accredited exam as well. And so where there's flexibility, where there's not, unfortunately, there's not. And so I think we all understand that, but we want this to be an exam that you're really proud of, ones that we can help your employers recognize you for. So there's also some great tools and resources once you're certified that you're able to use, like press release toolkits and stuff like that on the VACC website as resources to help you promote yourself as well. So with that, I don't know if I see, are there any other questions? I didn't see anything that I missed in the chat. Actually, I take that back. I do see one. So I apologize for that. And I want to make sure I address Christy's second part of her question. So her question was, is there a difference in the pass rate for practicing vascular access trained nurses versus those that are non-clinical administrators? So we don't really have non-clinical administrators that have taken the exam. Remember, they do have to either be a healthcare professional or one of those complementary fields like infection prevention. And so we don't break down the pass rate by discipline. So that is certainly something that we could see on the back end theoretically, but that is not something that we disclose publicly. So again, I think Amanda disclosed the overall pass rate. I will tell you, when the exam started, it was 63%. So it varies every year. And that's really a good, healthy exam will do that, because it really addresses the differences in the individuals. Certainly as the practice and the content outline is addressed through the job analysis, that will change it as well. But that is a pretty good industry standard pass rate. If you see an exam and it's a 30% pass rate, you should probably run. But if it's 95%, you should probably also run, because that means that exam is not going to be highly credible. So our goal is to, again, get minimally qualified people with the cognitive knowledge and skill set that is necessary to safely perform vascular access. And so you'll continue to see that change over time as the role changes. Right. And we want this to be seen as a profession, and part of being seen as a professional is to really have access to these types of certifications. So hopefully that addresses, Christy, your question as well. Are there any other questions that we can address for you? And we apologize for going a few minutes over time, but Amanda and I want to make sure that every single question is answered. And if there are future questions in the after today's program, you can email those into info@vacert.org. So Amanda, anything else that you want to add before we conclude today's program?
Just second everything that you've said, Hudson. We just want to make this as stress-free as it can be. We know tests, especially high-stakes tests like this, can be very stressful. So we want to get the application, the scheduling, everything like that as stress-free as we can for you. So feel free to let us know with any questions you might have. Like Hudson said, it's info@vacert.org. Otherwise, you can give us a call. All that contact information is available on our site as well. And I just wanted to thank you all again for coming today. We will have the link to the recording posted on our site, as well as emailed to everyone who came today, and slides so that you're able to kind of have those notes as we went along.
Awesome. Well, if we don't talk to you before, for those of you that will be taking the exam here in June, we want to wish you excellent luck. We can't wait to welcome you into the VACC family officially once you earn your certification. And then if there's anything that we can do for you, feel free to let Amanda know. She knows how to get a hold of me. I'm unfortunately the historian at this point of the organization. So it has been an absolute privilege to be involved with this group, and you're in excellent hands with Amanda. Is sort of your sort of Sherpa towards certification. So hope everybody has a great afternoon. Thanks again for joining, and we really thank you for your interest in pursuing vascular access certification. Take care, everybody.